Hey guys, today we're going to talk about assisted suicide. So, what is assisted suicide? Assisted suicide is usually done by a physician, described by the AMA as facilitating a patient's death by providing the necessary means and/or information to enable the patient to perform the life-ending act. Some examples of assisted suicide. First of all, there's the physician prescribing a lethal amount of medication for a patient to administer by themselves, either at home or wherever, per the patient request. A second is physicians themselves administering a lethal dose after the patient request. Just note that both of them are after the patient requests, or it is not considered assisted suicide. Does the nurse assist in suicide? The nurse can assist in suicide by administering the lethal amount of dose to the patient, or helping the physician administer said dosage to the patient, or not stopping or reporting a physician while they are assisting in suicide. Although this is legal in a few states such as Oregon, a nurse can still face legal consequences if assisting in suicide. So how does assisted suicide or euthanasia pertain to a nurse? The first thing to think about is that we are a patient's advocate. A majority of the time, the nurse is the first one that a patient is talking to about requesting euthanasia. After that, the nurse then has a responsibility to make a decision and contact the provider and give all information that the patient is requesting. Thirdly, we have to respect our patient's anatomy. So if the patient decides to go through with assisted suicide, either that being the physician injecting the medication, them doing it themselves, or the nurses injecting the medication, we have to respect their decisions even if it goes against our own. The final step would be to console family members after the patient has chosen euthanasia. We are there to provide support and help.
So when we talk about pro and cons for the assisted suicide, it's a very controversial subject, especially the center of the subject would be like the physician, because is the one most of the time have to perform or help on assisted suicide. So according to American Medical Association, it occurs that physicians provide the necessary means, information to facilitate a patient choice to end his or her life. So there are some pros and cons on this assisted suicide. Okay, so when we start with the pros, let's record the pro argument because not everybody agree with it. So it helps to help to reduce pain from the patient, especially with the patient who has a chronic pain, been suffering for so long, and then the patient also know that is a choice that is going to die, so that it can release from those pain, from suffering. Also, it can help on cost reduction, especially like if the patient know that he cannot afford to continue being in a hospital for so long, and then especially like the families. So the patient can decide, like to save my family on the cost, so that they can continue living. Let me just terminate my life. Also, the doctor and nurses in the nursing, I mean, hospital and nursing home or in facilities, they can focus to different another patients who need more. Um, I don't say more care, like another patients who need more attention, because on this one they already know that this patient cannot heal, can get not, or the health is not getting better anytime soon. So when the patient decided to end his or her life, I mean the medical providers, the nurses, they can focus on another patient who need more assistance, who at least he can show the sign of getting better. So also to reduce pain to the family. I mean, So when you talk about that, you're talking about instead of the family continue suffering, seeing their loved one continue suffering with those pain. So when the patient decide to terminate his life, it can help the family in one way or another to reduce pain. Like they can know, like, okay, now our loved one is gone, so we can just focus on something else in life. I mean, one of the other thing, it shows that the organs, if the patient decide to donate his organs to the surviving, I mean, to the patient who need organs, for example, like a kidney donor. I mean, you can say like, you know what, my kidney is good, and then I'm not feeling like, because I have a brain tumor and there is no way I'm gonna survive. He can just decide to donate that his organs, which are good to save somebody else's life. And then without a physician assistant, people may commit suicide in mass, horrific, and dramatic ways. I mean, we can see on this part that some some patients they already know, like, you know, I'm not going to survive. I'm not going to get healed anytime soon. So instead of them committing their own suicide, I mean, the physician can help them in one way or another to facilitate smoothly ending their life. So let's look at the cons of assisted suicide. Alright, let's look on the cons of assisted suicide. I mean, I call it argument because not everybody agree with it. And so the first one, it violates doctors' Hippocratic oath. I mean, this is the Greek word whereby the new physicians they have to go and swear upon the number of healing God that will uphold a number of professional ethical standards. And then one of them is to take care of patient no matter what. So when he start assisting him or her on terminate or ending their life, it violates that. I mean, kind of like jump to the second point that decrease the value of human life. Like when you decide to end your life, it completely means you don't see the value of your life. Like you don't see the value of continue living. I mean, I mean it it abuses. I mean, in the long run, it's gonna become very abusive to people. Like most people, for example, they might have like HIV/AIDS, and their mind, their mental is not okay. They know like for sure there is no way I'm gonna get healed. The only thing I'm gonna do is just to prolong my life as much as I can by taking those pills. But it's better just to end my life. So it's kind of like facilitate or accelerate suicide. The suicidal case will be more. And then some of the religion, for example, Christian, they believe that if you commit suicide, you are sent straight to hell. And then it is very harder for the families. I mean, that's the beliefs of religions. So I don't know about the patient, what he believes. I don't know about that, but it kind of go against some of the religions. And then doctors and families may promote to give up on recovering too much early. Like, for example, some of the diseases before we find cure, doctors were investing too much time on researchers, by too much time to research the cure for the disease, the cure for a certain treatment. So when the government or a certain state or promote suicide, I feel like it's gonna cause a lot of very intelligent people to continue researching for cure, because they're gonna know like, oh, this disease does not have a cure, so it is just terminated. So it kind of like the farmers also they're gonna give up easy. Like they're gonna know like, oh, our loved one is already have this certain disease. There is no way out. You're gonna get healed. So they're gonna decide it just to give up easy. Also, the government insurance may put pressure on doctors to avoid heroic measure or recommended the past procedure. I mean, as we know, most of these insurance companies, they more about money. How are they gonna save money? So if if a patient is on long-term care facility, and then they know like they have a will, they can put pressure on doctor to start talking with the patient about ending his life so that they can save money. I mean, that's how the insurance are. Most of the insurance they just like that. Also, I feel like we give too much power to the doctor. Like the doctor will have a say. Like they can prescribe a certain medicine just to terminate your life, or maybe they can feel like they have the power to take off your life. So those are some of the cons and pros of asset suicide. So in general, it depends on the matter of argument, depends where you stand on this. I mean, on this topic.
Principles from the identified codes of ethics that need to be examined in relationship to assisted suicide are patient's autonomy, doctor's integrity, and the capacity. Autonomy is the ability of the person to make his or her own decision. As far as doctor's integrity, it's how assisted suicide will create emotional or moral distress for the physician or compromise the physician's ability to provide care for the individual and other patients. Assisted suicide capacity is how the individuals must meet certain criteria in order to choose this type of life-ending plan. Different criteria is considered in different varying states. And as of now, there's only 6 states that actually legally allow it. The 6 states that legally allow it right now, as of April 2017, it has been legalized in the District of Columbia in Canada, as well as the 6 states that I mentioned in the U.S. The statutes are summarized below: Oregon, Washington, California, Vermont, Canada, Montana, and that's how they're regulated if you take a look at the different types of statutes.
Current events in 2018 include California reporting 452 individuals receiving prescriptions and 337 of those people dying after ingestion of the dispensed medication between January 1st and December 31st of 2018. In April, Hawaii becomes the 7th jurisdiction to enact an assisted dying law. Their law is called Our Care, Our Choice Act, and it went effective the next year. In May, the California End of Life Option Act was suspended for 3 weeks following a district court ruling. However, in June, they reinstated that law. In 2019, Colorado reported that 170 prescriptions of aid in dying medications were written by physicians for patients, and 129 of those, the medication was dispensed by a pharmacy. In April, New Jersey becomes the 8th jurisdiction to enact an assisted dying law. Their law was called the Aid in Dying for the Terminally Ill Act, and it went effective in August. In June, Maine becomes the 9th jurisdiction to enact an assisted dying law. The Death with Dignity Act went effective in September. In 2020, Oregon reported 2,518 people receiving prescribed medicine, and 1,657 of those patients died from ingesting the drugs that were legally prescribed to them under the law. In January 2020, the state of Vermont reported 34 physicians reporting forms that they completed for 34 patients between July 1st of 2017 to June 30th of 2019. As of 2020, there are 10 states in the U.S. that have an assisted dying law, which include California, Colorado, DC, Hawaii, Maine, Montana, New Jersey, Oregon, Vermont, and Washington.